Measles is also known as rubeola. Rubeola. How you will define measles? Measles is an acute, highly contagious and serious childhood exanthematous viral illness which is characterized by fever, maculopapular rashes, cough, coryza, and conjunctivitis. This is the definition of measles. Okay. As regarding coming to the epidemiology, this etiology of measles is measles virus, which belongs to Paramyxoviridae family and morbillivirus genus. The reservoir of the virus is the humans are the only host of the measles virus, and there is no carriers are known till now. The source of infection is the nasal secretion, throat, and respiratory discharge are the sources of infection. And the entry of infection is through the nose and mouth, and exit is the upper respiratory tract. So, how the measles is transmitted? It's basically transmitted by the droplet spread, and in some cases can be transmitted via direct contact with the nasal and or throat secretions of infected person, and less commonly can be transmitted by airborne mode or indirect contact like utensils, etc. And it's a highly contagious disease. The secondary attack rate in household contacts is more than 80%. So it's very highly contagious. And the virus can be transmitted 4 days before and 5 days after the appearance of the rashes. Still, before 4 days and after 5 days of appearance of the rashes, the patient or the child is remains infected. The incidence is equals in male and female. There is no sex difference, and the susceptibility is more in malnourished child. Okay, how the measles patient presents clinical manifestation. So, measles is common in preschool children body huncha, and the incubation period is 8 to 12 days, and the clinical manifestations can be divided into stages. Prodromal 3 stages. First is the prodromal phase or stage, which lasts about approximately 3 to 5 days. And the prodromal stage starts with low-grade fever on the beginning. Fever gradually rises, and there it is. For the easy remembrance, you can remember the 3 C's. What are the 3 C's? That is cough, coryza, and conjunctival congestion or conjunctivitis. So there is some red pinpointed spots which is surrounded by the erythema base, which seen in the 2nd and 3rd day of the illness. That is known as Koplik spots, which is the pathognomonic of the sign of the measles. And we can find the Koplik spots opposite to the lower second molar on the buccal aspect of the mucosa, buccal mucosa. So, prodromal stage begins with fever, and fever gradually rises till the eruptive stage. And second stage is the eruptive stage, which starts from 4th day onwards. And on the fourth day, the rash appears. With the appearance of the rashes, fever rises. This is the how can you differentiate from other viral exanthematous illnesses? This is the point, right? In case of measles, fever rises with appearance of the rashes. In other certain viral illnesses where the similar rashes appears, the fever subsided before the appearance of the rash. This is the differentiating point. So you should remember this. And rash rapidly becomes macular. Initially, rash starts with small macular regions and rapidly becomes maculopapular and spreads the whole body within 2 to 3 days. The sequence of the appearance of rash is first appear behind the ear, along the hairline, forehead, face, neck, then spread to the chest, back, abdomen, then to the limbs, hand and feet, involving the palm and soles. This is the order of appearing the rashes. As you should know. So if you see the patient with fever and rash, you must ask the question where the rashes appeared first, right? And the third stage is the convalescent stage, which is the last stage. And in this stage, the rashes starts fading in the same order that it appeared. So then leading to the fine browny discoloration and brownish discoloration of the skin, and this whole course takes 10 to 14 days to recover completely. This is the clinical manifestation of measles. मैले यो घरिघरि किन सर्दैन? Look at this side. It has some eye discharge. Conjunctivitis is not so distinct, and it has maculopapular rashes involving the face, neck, and upper part of the chest, right? And the back. As you can see the lesions in the back. And this is the cochlear spores. Inside the oral cavity, just opposite to the second molar teeth, you can see some dot-like whitish lesions which are surrounded by the erythematous base. These are the cochlear spot, which is pathognomonic of the measles. Okay, now coming to the complications. If the child with measles didn't treat properly, then some child may land into complications. The complications are more frequent in the extreme age, like if the child is very young, especially in the infancy. If the child is less than 1 year, and is more frequent if the child is malnourished, especially severely malnourished child are more vulnerable to have complications of measles, and is more in immunocompromised child, and it is known as proven as fact that vitamin A deficiency is also a risk factor for the developing complication of measles. This is a very accepted fact. And transient loss of There is the transient loss of tuberculin hypersensitivity following measles. It is seen that it is also a proven fact. What are the complications? Okay, complications can be related with different systems, right? Regarding the respiratory system, bronchopneumonia is the commonest complications you can see in children. Pneumonia can be a viral etiology or superadded bacterial infections like staphylococcus pneumonia. And such other complication which is related with the respiratory system is the otitis media. So, otitis media, laryngitis, tracheitis, similarly bronchitis, and there is more chance of flaring of latent tuberculosis after having measles infection. And in the gastrointestinal system, child may develop diarrhea, and we do get acute appendicitis in some children after measles infection, and some develops hepatitis. Similarly, malnutrition is another major complication which is seen more in the developing country, and other neurological complications like febrile seizure, which can be seen in less than 3% of the population, and acute encephalitis. Similarly, child may present with acute encephalitis following measles, and it is observed after 3 to 4 days of the illness, and the initial stage in the eruptive before to the prodrome and at the end of the prodrome and the eruptive stage and the beginning of the eruptive stage. Sometimes we find the sign and symptoms consistent with the meningitis encephalitis-like symptoms. What are they? Child may have high-grade fever, may have altered sensorium, photophobia, neck rigidity, may complain of intense headache, vomiting, so on. And subacute sclerosing encephalitis (SSPE) is a late complication of measles. This can be seen after several years of having measles. This is a late complication. As how we will diagnose? Okay, how we will diagnose a case of measles? Measles is basically a clinical diagnosis. You can diagnose measles with the sign and symptoms of measles, right? And along with the clinical manifestations, we do certain laboratory tests. What are they? In the blood, we do the CBC, complete blood count, where we can get the report of low WBC count, that is leukopenia, and we find the normal CRP and ESR. CRP, if we do the test CRP and ESR, they are normal. And serologicals, it can be confirmed. Measles can be confirmed by doing some serological test, by detecting the serum anti-measles antibody, IgM, as in 1 to 2 days after the onset of the rashes to 1 month. So we can do the serum antibody, IgM will be positive after 1 to 2 days of rash and remains positive for 1 month. So in this period, we confirm measles by detecting the antibody. if we have the facility, isn't it? And another antibody is we can uh, check for the uh, IgG antibody. If we found this, if we found a four-fold rise in the IgG antibody, it is confirmatory of the confirmatory of for the measles. So these are the confirmatory diagnostic tests. And if the facility in the Western countries and developed countries, the virus, they can isolate the virus by viral culture. And viral culture can be done from blood, urine, and respiratory secretions. But we don't have this facility. So we should based on our clinical sign and symptoms, and we can do some serological test. I can go for the serum IgM antibody detection. Then in Western country, we can do the PCR. So, similarly, we can do the PCR test for the detection of the virus. What are the differential diagnoses? Differential diagnosis. Measles can be differentiated from other exanthematous illnesses. Common is the rubella, which is known as German measles. How can you differentiate rubella from measles? I have already mentioned, as in case of measles, there is rash is almost similar in both of the diseases, but you cannot find the public spots in rubella, and the duration and severity of the illness is less severe than the measles. And adenoviral infection, enteroviral infections. In both of these conditions, there are fever and rashes. But along with the fever and rashes, there are other features that distinguish from the measles. And Epstein-Barr virus, as Epstein-Barr virus infection, this is another viral infection. And as exanthem subitum or Rubeola infantum in infants, this is also known as the fifth disease. As in this disease, the appearance of the rash is different, and the extent and site of the lesions are more important. You should focus more in the history. Erythema infectiosum of fifth disease. Exanthem subitum or Rubeola infantum in infants, it is known as sixth disease. And erythema infectiosum is known as the fifth disease. Don't confuse. It is seen bit in older children, right? And similarly, we should differentiate the measles from Kawasaki disease or Kawasaki syndrome and drug eruptions or drug allergy rashes. In Kawasaki disease, there is a diagnostic criteria to diagnose Kawasaki. There's fever of more than 5 days with rashes, cervical lymphadenopathy, disformation, and conjunctivitis, but non-purulent conjunctivitis, so on. These are the other etiology of fever with rashes, which we have discussed in the previous class. So I will not spend more time to this. How we will treat measles? As measles is a viral illness, we don't have this proper antibiotic treatment. The treatment consists of symptomatic, and if there are some complications, treat for the complications. So what are the symptomatic treatments? So give antipyretics for fever and to relieve pain, headache, myalgia, isn't it? If there is conjunctivitis, give some eye drops, so on. And routine antiviral therapy is not needed and it is not effective in case of measles. So the supportive measures, like if the child is having difficulty in breathing, fast breathing and having pneumonia, so in such condition, use humidification of the ear and oxygen supplement is necessary and it will relieve the symptoms. Antipyretics for fever and pain, and proper hydration if child is not able to take oral feeds, and oxygenation if required. As treat if the complications are there, treat for the complications accordingly. And we give vitamin A to all the children with measles. What is the dose of vitamin dose and how many doses to be given? This is the WHO recommendation. In your OPGI book, there is it was written that this is single dose of vitamin A is given to the child with measles, but the WHO recommends 2 doses. 2 doses. So we should follow the WHO guidelines. What is the dose? Up to 6 months. Up to 6 months, you should give 50,000 international unit immediately on diagnosis, and you should repeat the same dose on the next day. And the child with a 6 to 11 month old child, give 1 lakh international unit at the day of diagnosis and repeat the same dose next day. 2 doses are required. And if the child is more than 1 year or 12 months, give 2 lakhs international unit on the day 1 and repeat the same dose in the next day. As if the child has ocular manifestations of vitamin A deficiency, hence you should have to give a 3rd dose. It should be given in the 2 to 4 weeks after the 2nd dose. If such ocular manifestations, you should give 3 doses of vitamin A, and if there is no, in the absence of ocular manifestations, simple measles, you give the 2 doses of vitamin A. This orally. This is the oral dose. Okay, and so the vitamin A is indicated in all cases of measles, not only in the severe measles, in all cases of measles. How can you prevent the measles? First, isolate the child with measles. As you know, it's highly contagious disease, so isolation is very important. How long to isolate? So, virus infected child may shed the viruses 7 days after exposure to 4 to 6 days after the onset of the rash. So, you should isolate the child for this period. But it is for the immunocompetent child. If the child is immunocompromised, you should isolate the child throughout the illness. Okay, and as we can, the measles is a fully preventable, vaccine preventable disease. So we can prevent measles by giving vaccine, proper vaccine. As vaccine is measles vaccine is available as a monovalent preparation or a single preparation, or measles vaccine can be combined with Rubeola vaccine, that is known as measles Rubeola MR, and this one we give in Nepal. In the Nepal immunization schedule, we give the measles and Rubeola combination vaccine. And In Western countries, they give the measles, mumps, and rubella, which is known as MMR. And it is the one which the WHO recommends. WHO recommends the MMR, but we don't have MMR, so we give the MR vaccine. You should know it. And it's fully vaccine preventable disease, so we can prevent it. Okay, few words for regarding the MMR vaccine. MMR vaccine is a live attenuated vaccine which is freeze-dried as you should store it at 2 to 8 degrees Celsius, but can be frozen. And we must protect it from the light all the time, and it produces both the cellular and humoral responses after immunization. And what is the dose and route? Is give 0.5 ml as by subcutaneous route. And what is the site for vaccine? It is given on the right arm, right upper arm, or we can also give it on the anterolateral aspect of the thigh. And thus it produces the immunity for lifelong. And Nepal, and what is the schedule? In Nepal, we give in the 9-month and 15-month. 2 doses are required. MR vaccine, we give the 2 doses. When at 9-month and 15-month of age, right? What are the adverse reactions? It can cause local pain, tenderness, febrile seizures, arthralgia, sometimes aseptic meningitis, and transient rash and fever. What are the contraindications? Measles MR vaccine or measles vaccine should not be given in malignancy and immunodeficiency diseases and immunosuppressive when the child is on immunosuppressive therapy, and those who are the recipients of blood or blood products, receiving immune globulins, whole blood or PCB. And during pregnancy, you cannot give the measles vaccine. Thank you. So, beyond the point.